Now I'm recording. Now you go ahead. Okay, welcome. Here we have Dr. Wolfgang Vicky. I don't know if I can pronounce the name very well, but he's a US-based medical doctor. And we have some few questions we will be asking. So remember less and God bless each and everyone. Thank you. So.
So thank you for having us once again today in this session. Well, the question I have with me here is now due to the rate of the high rate of trauma that is happening among our youths in this current generation. So now my question is how can we help the traumatized? How can we help heal the traumatized?
Well, basically, how to help someone that's traumatized, and I guess I'd like to start out by saying thank you for having me here to discuss these important issues with you, and we just ask that God blesses this time and it gives us an opportunity to show His way. And I think it's important to realize that, first of all, that God does understand our trauma and our pains. Isaiah 53:3 says, He is despised and rejected of men, a man of sorrows and acquainted with grief. And we hid as it were our faces from him. He was despised and we esteemed him not. So God understands not only the trauma, but also understands how we how we esteem him not, how we don't really understand. And dealing with traumatized people, probably one of the biggest medicines that we have is tincture of time. Matthew 5:4 said, "Blessed are those who mourn, for they will be comforted." Does that happen immediately? For some people, there is an immediate response from God, but sometimes God uses time to heal people. And I think of Job and his friends, and I think where they fell short was that there was a time of allowing him to mourn, but then I think they pressed things too quickly and didn't allow him time to heal and time to work things through. How that works as far as in church things, sometimes there are, when someone is traumatized, they act out, and they act out with anger. Sometimes they'll act out in different ways that aren't very comforting.
Please, can you unmute yourself again?
Okay.
Uh-huh.
All right. Can you hear me now? Okay.
Yes.
Okay. Okay. Yeah. So just Matthew 5:4 said, "Blessed are those who mourn, for they will be comforted." So sometimes what's missing there is a tincture of time. And sometimes I've seen in church situations where people say there's unforgiveness. And I think I've talked about this issue before, is that sometimes when there's a major trauma, you know, the response of some is acting out and just giving people time, even if they act in ways that we don't find very, very nice. And that may be a testing of the patient or the client or the brother or sister. They're testing you if they act out, and if you leave, and then we failed. But being with those people and through their valleys, I think that's kind of the proof of faithfulness. So I hope that answers that question, but yeah.
All right. Thank you. Thank you very much for that answer. Now, please, still online with this. Now, what is the therapy that would be best for the traumatized?
The best therapy for traumatized people, I think, well, there's a book out by a doctor named Jay Adams. It's Competent to Counsel, an introduction to nouthetic counseling. There's two different, or there's at least a couple different major forms of counseling. One of them is the mainstream type thing, is called a humanistic counseling, where you try and just let people work through things, find their own truth, and then there's also this thing called nouthetic counseling. And that word was used actually in the New Testament by Paul. And it's basically the translation of that is to admonish, correct, or instruct. Romans 15:14 says, I myself am convinced, my brothers and sisters, that you yourselves are full of goodness, filled with knowledge, and competent to instruct or counsel one another. And so basically, if we're followers of the word, then and we're faithful in that, then we are competent to counsel and to reach out to our brothers and sisters. In modern times, in many places, at least, and I'm speaking mainly here in America, and I'm not sure how it is in Africa, there's this tendency to try and seek out the professionals. But the Bible tells us that we are competent to counsel, and so studies are starting to come in right now that show that a friend that's good, that listens and spends time with the traumatized person, is just as competent and has just as good outcomes as a professional counselor. So what makes a competent counselor? Romans 15:4 said, actually 2 Timothy 3:16 and 17 says, all scripture is breathed out by God and useful for teaching, for conviction, for correction, and for disciplined training in righteousness, in order to fit and fully equip the man of God for every good task. And Acts 20:31 says, therefore be alert, remembering that for 3 years, day and night, I didn't stop counseling each one of you with tears. So that tells us there's a couple of important concepts and components to being a competent counselor, even as a lay counselor. And one of them is knowledge. And that goes in the Romans verse, filled with knowledge and competent to instruct and counsel one another. So we need to know the scriptures, and we need to know, and that's really important, because people can bring in things, and we need to recognize, is this of God or is this of the devil? Is this of man? And so we need to know the scriptures. We need to be able to deal with things and bear one another's burdens, be able to shed some tears with them. And I didn't stop counseling each one of you with tears, Paul said in Acts 20. We need to be prepared to struggle along with your brother and sister and give grace. And so the knowledge is the truth, the tears is the grace. And we need to have a proper balance between that. If you have all truth, you have someone that's very hard and say this is scriptural, this isn't scriptural, but you don't have the heart of the person that you're trying to help with the trauma. On the other end of the spectrum, you have someone that's all tears. If someone is just all tears, and that lends itself to compromise and distorts and destroys and twists the truth. So to be competent, you have to have a proper balance between truth and grace. And the other thing I think to properly be a good counselor and dealing with things like depression is being beyond reproach, accountability, in other words. It would be inappropriate for a man to be counseling a woman in private. The Bible does call us to be accountable and to be beyond reproach. So oftentimes I think dealing with things as a team would be a very important thing to do. And again, contrast this with humanistic counseling. It's based on the assumption that individuals already possess an inner truth, your truth, my truth, that kind of things. It's another name for this is called client-centered therapy. And it goes wherever the patient or the client wants it to go. And oftentimes that'll go in some very dark places and places that are away from God. So we need to be anchored in truth and grace.
Oh, thank you so very much. That's very, very encouraging and helpful. In line with the depression and traumatic people, then we also have people suffering from blood pressure, those who try their own best not to commit suicide. So how do we handle people with blood pressure? Is there even a cure for a blood pressure?
Okay, there's basically two different kind of blood pressure problems. There's the primary hypertension, primary blood pressure, and that's the kind of blood pressure problems where there's no identifiable physical cause, and that's about 85% of the cases of high blood pressure. And the other type is secondary hypertension, and that is due to it's secondary or due to some kind of physical problem. And sometimes it could be a constriction of the artery that feeds the kidneys, and the kidneys help regulate your blood pressure based on how much fluid you retain or get rid of. And so if there's a constriction of that artery, the kidney wrongly reads that the pressure is low downstream. You may have a tumor on your adrenal glands. That's a gland above your kidneys. And that could be secreting abnormal amounts of hormone that controls blood pressure. Stress hormone in particular. And then can be problems with your thyroid. And so thyroid controls your metabolism. So if you have an overactive thyroid, your metabolism is higher and your blood pressure, your heart rate goes higher. And of course that would cause your blood pressure to increase as well. That's about 15% of the cases. So what about the other 85%, the primary hypertension? I think that's kind of what we're talking about. In America, a big problem with that is weight problems. If you have, I think the fact on that is for every pound that you're overweight, you have an extra mile of blood vessels and capillaries. That's the very smallest blood vessels to pump blood to supply that extra pound if you had to string it along in one long line. So you'd imagine if you're 20, 40, 50 pounds overweight, that's a lot of extra blood vessels to pump blood through. Of course, you're going to need high blood pressure to do that. So getting rid of extra weight, stress, being in a high stress job, basically, your body prepares you to fight or flight. That's the typical stress response. So if you're in a stressful situation, your blood pressure can be high. And on a spiritual level, hidden sin can cause high blood pressure. And that's part of that stress component. So it's important to kind of sort out, just because you have high blood pressure, medically speaking, as a doctor, I don't just assume that there's no cause. We have to check out the thyroid. We have to check out the kidneys. We have to check out the hormones that cause the tumor, that may be related to a tumor on top of the kidney. If that's all negative, then we do treat the blood pressure. But I think where we come up short in the medical community is we address the weight. For stress, oftentimes we'll put people on anxiety medicine or depression medicine. But where we fall short of is dealing with things like hidden sin. Well, what's going on in your life? Asking questions like, what's going on with your life? For children, we ask, how are you doing in school? What are your grades? Do you have friends? Who can you talk to? Is someone touching you in an appropriate way? Are they touching you in your private areas? Those are things that that we can do as clinicians to kind of help sort that out, and that opens the door for any number of further questions.
Yeah, thank you so very much. That's so educational and so very much helpful. So does that mean, I did not hear your comment on, can blood pressure be cured at all?
Okay, as far as, again, the artery that leads to the kidneys, that can be taken care of surgically or with a stent. If there's an adrenal tumor, that would need to be removed to cure it. Treating thyroid problems, that would be curative. Losing weight, that would be curative. Addressing the stress, that would be helpful, and addressing the hidden sin. So a lot of these can be cured. Sometimes all of those things are negative, and meaning that there's no problem, and so you end up treating it. So that's the difference between cure, means that it's gone forever and you don't need to do anything else with it, aside from maybe just following up every once in a while, and being treatable, which means taking, in some cases, medicine to treat that blood pressure. So it depends on what the underlying cause is.
Okay, thank you so very much. That is very, very helpful. So going to the next question, what are the possible ways of managing people with depression? I think we answered this one.
Yeah. Mm-hmm.
Okay, then the other one is self-medication dangerous in any way?
I guess it depends on self-medication. When someone says self-medicating something, I see two ends of a spectrum. On one end of the spectrum, you have people self-medicating with things that are not meant as medicine. And here I'm thinking of treating something like depression or trauma or anxiety with alcohol or drugs. Those are clearly not meant to be medicine. And the other extreme would be a total reliance on the professionals, and just focusing on them and nothing else. So again, the first of the spectrum is self-medicating with things that aren't meant to be medicine. But then you have lesser degrees where you have an over-dependence and an emphasis on something like herbal remedies, home remedies, in an effort to extend our lives as much as possible. And this is basically a total reliance on yourself. Again, the other end of the spectrum would be a total reliance on the professionals. Second Chronicles 16:12 says, King Asa of Judah is criticized for relying on his own physicians. And it says, yet in his disease, he's not to the Lord, but to the physicians. So in both cases, there's a danger in the attempt to remove God from the healing process. On the total reliance of self end of the spectrum, there's a danger of addiction, overdose, and death. Self-reliance end of the spectrum, or a total reliance on others end of the spectrum, there's a spiritual danger of narcissism. And narcissism is we don't need God because we're so smart and we can figure it out. There's also a spiritual danger of nihilism. We can heal ourselves, but for what purpose? You know, what purpose is it to be physically healthy if we have purpose in life? So in both cases, this takes us away from an eternal perspective and gives us a false hope of a temporal pleasure and joy, but it's a fleeting thing. It's not a lasting thing. And again, John 14:6 says, I'm the way and the truth and the life. No one comes to the Father except through me. So everything that we do, every moment that we have in life, even the healing process, needs to be through Jesus in order for us to have an eternal relationship with God. So balance. God did give us things like herbs and some medicines. So treating yourself with those things in a way that they were meant to be used, there's nothing wrong with that. There's nothing wrong with using physicians to help us heal. It's the extremes that we have to be careful about.
Oh, thank you so very much. That's so educational and so helpful. We will take the next question from Yakubu.
All right. So since we're on drugs and method of taking drugs, so now my question goes like this. Now, what are the social, the psychological, and the spiritual dangers of drug abuse? Now, because I found out that in our current generations, a lot of the youths tend to go into drug abuse. Now, so if we would love you to enlighten us and enlighten the audience at large on what are the social, the psychological, and the spiritual dangers of drug abuse. Thank you very much.
Okay, yes. And of course, all of those are related. I like to look through things as the psycho, social, and physical concept of the whole person. And so all those things are related. Psychiatrically, it can be adverse if you're an outcast socially. If you have chronic illnesses, it affects the other two. So those are all kind of interrelated. But when you're talking about drug abuse, what you're really talking about, and this goes the same for fantasies or any other kind of escapism. And these are all tied in with the idea of escaping from reality. It's the denial of God's reality. Reality is God's realm. Fantasy is our own realm. We're creating a world that's not of God, it's of our own making. And so that's kind of the difference. God is not fake. He's not artificial. When we go into this escapism, this denial of reality, that is fake and it is artificial and it's temporal. God's perspective and his world is eternal. And so drugs and other forms of escape from reality are really a defiance of God's realm. It's the attempt to create a world without God in which a person's pleasure or fantasies are the center of their own artificial universe. And sometimes drugs are taken out of which an artificial world is created, and God is either irrelevant or he's powerless, which is not true. It's something that's fake. John 14:6 again, and I think this is going to be kind of a recurrent theme, is I am the way, the truth, and the life. No one comes to the Father except through me. So there is a way through hopelessness and the emptiness and shallowness of a narcissistic, and narcissism is a self-centered existence. It's by embracing the truth. I am the way and the truth, not a truth, not your truth, not my truth, but the truth. And the reward is life. I'm the way, the truth, and the life. The reward is life by coming through to the Father through Jesus, and Jesus alone. So if there's a rejection of this reward, it leaves us open to demonic forces, permanent separation from reality outside of drug abuse. Now, it's commonly known in the medical field that that certain drug use can send you into something called a psychosis, and that's a psychological condition where you have a total separation from reality. You might see people behind trees that don't belong there, that aren't really there. You might be hearing voices that aren't there. And you might be seeing aliens and all sorts of things. That's a permanent or a long-lived separation from reality outside of drug use. Now, some people say it goes the other way, that people with psychiatric problems are prone to drug use. But in reality, I think there's a denial even in the medical community to acknowledge, and the studies do bear this out, that even casual drug use can devolve into something like this. And basically, we can call this a psychosis. We can give it a name for it. But on a spiritual sense, this is opening yourself up to demonic forces. And it can happen even after just a brief drug use. So if you want to be separated from God, if you want to open yourself up to demonic forces, and if you want to create an artificial and a fake reality, then you'll use drugs. If you don't, if you want something permanent, if you want something real, if you want something good, then you won't even consider doing this. So.
Thank you so very much. Yeah, this is actually very, very educational and helpful. We only have 7 minutes left, and the last question, let's see how we can get it. But this is, if this 40 minutes is exhausted, this is not the end of the world. But the last question from our side, of course, we have many audience too, and I believe maybe they might have questions, but let's see how far we can get with this one. So more upgrades are happening in education, health sectors, technologies, and now people are even more brilliant and they can create and invent a lots of things. Now we know that there's even gender surgery and all of this LGBTQ and the rest of them. So tell us, what do you think all of this improvement or education in the health sector will affect the church? And what is your own advice for church and church leaders?
Okay, well, that's a pretty big subject. I guess in the interest of time, I can address maybe one component of that, and that would be how can we as a church be involved in the medical field? Maybe there's young people that are thinking about going into nursing, or even a doctor or a therapist. How can we as Christians do this? And be effective in reaching out to people. So I just want to basically give a little bit of a background in the medical field, in Western medicine anyway, which I'm the most familiar with. And of course, that starts with the Hippocratic Oath as being a cornerstone to Western medicine. And specifically, it promotes or prohibits things like euthanasia. Neither will I administer a poison to anybody when asked to do so, nor will I suggest such a course. It also prohibits abortion. I will not give a woman a pessary to cause abortion. And then there's the major cornerstone of Western medicine is the concept of do no harm. And for that, the Hippocratic Oath says, I will use treatment to help the sick according to my ability and judgment, but never with a view to injure and wrongdoing. Now, square that away with Plato. Plato was an ancient Greek philosopher and not too far removed from Hippocrates. And Plato explicitly advocated abortion and even infanticide, not only as an option, but a duty of the state. Socrates, Plato's teacher, is famous for ending his own life by drinking a concoction of poison hemlock. So how do we square that away? What is the foundation of Western medicine? Well, Hippocrates belonged to a group of like-minded people called Pythagoreans. And the ancient Jewish historian Josephus stated that for that man, Pythagoras, he's talking about, is in fact said to have transferred to many of the customs of the Jews to his own philosophy. So in essence, the practice of Western medicine is a biblically based idea in practice. Now today, however, you might be surprised to know that in all medical schools that I'm familiar with, they don't really ascribe to those traditional practices of the Hippocratic Oath. There's only a promise to not do that which is illegal. And of course, people in Nazi Germany could have ascribed to that in good conscience, saying we're not going to do anything illegal, but that doesn't mean all sorts of terrible things were going on. But after World War II, there came this sense of nihilism. And again, nihilism is despair, meaningless of life. And so Western medicine has been caught up with that in a major way. And it's kind of reached a tipping point in Western medicine. So it translates to abortion in America up to the point of birth in some states, and euthanizing the young people, even for depression, for example, in the Netherlands, and soon even children in Canada. And this means Christians won't be able to, in good conscience, work in many fields of medicine, such as clinic workers, prescribing, say, single women with birth control that it acts as an abortifacient. And in Canada, if you're a primary care or a GP, they may come to you and ask for euthanasia. And a Christian in good conscience can't do that. Thou shalt not kill. So what does that lead us to? It doesn't seem as bleak as it does. God can turn this evil into something good, because there are opportunities. The case comes to mind in a woman veteran in Canada She was a military veteran. She was a Paralympian. She was paralyzed below her waist. And she needed a chairlift at home. And the government said, no, we're not going to fund the chairlift, but we will finance your euthanasia. And so things like that in the medical field, medical people will either lose the skill to treat some of these chronically ill people, or they'll lose the will to do it. They're just not interested, because some of these people, people with chronic illnesses, are very difficult to treat. So that gives us opportunities for the church to step in and care for these people. But we can only effectively care for them if we remain a salt and a light to those in darkness. And that means not compromising on things. It's very easy to compromise and say, this person is suffering, let's put them out of their misery. But we know where that leads to. And in Canada and parts of Europe, euthanasia levels are skyrocketing, and I think it's probably going to go off the cliff in not a very long period of time. So that adds to the spirit of nihilism. And it's a great opportunity for the church to step in and treat these people. If you think of like the Romans, when you had a disabled child, they would leave them to die out by exposure in the roads leading to and from Rome, and Christians would take them in. So this gives us an opportunity. God can turn something evil into something good. But that only helps us if there's no compromise. And liberal churches have a very poor track record of compromising on these things. So we need to have some strong convictions and always follow God. I would avoid areas that are moral landmines, being a GP or even a pediatrician, where the expectation is you give me hormones to turn a little boy and to castrate him, or turning him into a girl as far as his physical appearance. And just, it's very difficult to swim with a millstone